Hello everybody, Jeff Siegel here with your Levels log. I am taking you through my journey with the Levels continuous blood glucose monitor. Got this little puppy right here strapped onto the back of my arm. All right, been updating it, been playing with it. It is a pretty cool tool to take a look at how my body is managing my blood sugar during the day and how all different things from stress to sleep to exercise is affecting my body's ability to maintain nice steady blood sugar levels. And so today, one thing I want to talk about is exercise. Right? Now, if you watched one of my previous videos where I talked about I did a high intensity workout and my blood sugar, guess what? It went through the roof. And this is a natural and normal response, all right, when you're doing high intensity exercise, that your body is going to release stored sugars that you have in your liver and in your muscles to help provide enough energy to the muscles to fuel the movement that you're doing. Right? And just note that the higher the intensity of exercise, the higher your heart rate is, the more level of exertion, right? Generally, the more sugars you're going to be burning, right? You're tapping into those sugar pathways versus, all right, lower intensity exercise can actually have the opposite effect on your blood sugar. It can help lower your blood sugar. And what's one of my favorite lower intensity movements? Walking. So walking is one of the best things that you can do to help regulate your blood sugar to prevent these large spikes from happening. And especially walking after you have a meal is one really good technique to start keeping that blood sugar in balance. And I know there's a lot of cultures where they will go for a short walk after a meal or after dinner to help aid in digestion. And while this tradition might be fueled more by culture than physiology, there's actually a lot of really good sound reasoning behind doing this. Right? And walking and any sort of rhythmic contraction of the large muscles in your body, aka your legs and your butt, right, is going to help draw some sugar from your blood back into the muscles. Guess what? Your muscles actually account for 70–80% of where all that blood sugar goes when it's getting pulled out of your system. And so this is a call for obviously making sure that as you age, you maintain your muscle mass as an important way to just help regulate your blood sugar to prevent you from trending towards this place of becoming pre-diabetic or diabetic. Is recognizing the older you get, especially once you hit age 40, right, there's a process called sarcopenia, which means age-related muscle loss, and you start to lose a certain percentage of your muscle year by year just as a result of changing levels of hormones in your body. Now you add on top of that the fact that typically as you get older, you get a little bit more sedentary. So now you've got a situation where you have less muscles and less movement, and guess what? That can lead to disastrous blood sugar control. And the cool thing about getting to use this Levels device is I got to test this out. I got to eat my lunch one day, all right, and then just come back and do some work in front of the computer sitting on my butt. And then I got to eat basically the same lunch again the next day, but I went out and I took a nice 30-minute walk around the neighborhood. And yes, the day where I went out for a walk, you can see my blood sugar rise a little bit after the meal, as it's supposed to do because my body needs to process the sugars that I ate. But then that blood sugar just started to drop way faster and more quickly when I was out taking the walk, as opposed to when I was sitting on my butt and the blood sugar stayed elevated a little bit longer. Now, there's some interesting things that can happen if you're really, really insulin sensitive, and I noticed this with myself where I went out for a walk after a meal, and guess what? After that I ate, my body released a bunch of insulin. That's going to help signal my cells to pull that sugar, right, out of my blood into my cells. But when I combine that with the walk, now all of a sudden my blood sugar levels are actually dropping almost too quickly and they can get too low. And so this sometimes is called kind of rebound hypoglycemia. And what happens then is you start to get on a different sort of roller coaster ride with your blood sugar levels bottoming out. Then your liver starts producing more sugars to help bring it back up. And normally things can kind of normalize back out. But again, any sort of large fluctuations does provide a little bit of strain, this extra work for your body to help regulate and rein things into a baseline where things can function optimally. So just some cool things that I'm noticing. Again, big takeaway for today is walk. Even a 10-minute walk after a meal is one way to help kind of normalize those blood sugar levels if you're going to be eating a large, especially large kind of carbohydrate meal. Generally speaking, I'm a huge fan of walking anyway. It is one of the best activities that you can do for your body and for your mind. And if you go out there and take a deep breath and connect with the nature and the trees and the animals, one of the best things you can do for your heart and your soul. So this is Jeff Siegel. Until next time, breathe, smile, and take a nice walk.